Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about how to make body paragraph in OET writing. Okay. Because body paragraph is very important when you are writing a letter, especially when we are writing to the particular recipient of the letter. For example, if you are writing a letter to a social worker. So here, after writing an introduction, so which paragraph can be written? Either a social background paragraph, not a present medical history paragraph. So there will be a confusion. And also we can see there are two type of students. Some students may write social background after the introduction. And some students may write present medical history paragraph after the introduction. So the both are right. But if your content is which is related to the social worker, which means your letter is good. If the content is irrelevant to the social worker, your letter is wrong. So thereby, what are the main important information that can be written in our body paragraph when you are writing a letter to the social worker? Social worker is a person who is supporting a patient for the social needs, not for the medical. So social worker is not belongs to a medical profession. She is a social supporter and social service supporter. So thereby, when you are writing a present medical history paragraph, it is better not to write about detailing regarding the medications, wound dressing, and also better not to write about the physiotherapy. So this is under irrelevant information to the social worker. So what can I write? Which means you can write, patient was admitted so and so date and was diagnosed with a so and so condition. During hospital stay, patient received adequate treatment and management. Fortunately, patient recovered well and is being discharged on this day. So that much is more than enough for the social worker to know more about the present medical history of the patient. But social background, which has to be elaborated as much as possible. So you have to write in case if the patient is refugee, they came from which country to which country and what is their social status and where they are working. Does they have language barrier? And how about the GP, family GP is there or not? And also you can write about the habits, because social worker is a person who can arrange activities and programs. For example, weight reduction program, and also can arrange a person for the patient to join in quit smoking, and also can help the patient to get the adequate social services and needs. For example, economic income producing activity. So these are all related to the social worker. So these are all points which has to be written in your body paragraph. That is very important thing. So now you got a clarity of like what information is necessary for the social worker to write it, isn't it? Now second person is a physiotherapist. When you are writing for the physiotherapist, so which passage can be written as a body paragraph after the introduction? So as usual, present medical history paragraph. In the present medical history paragraph, it is not mandatory for you to write the tablet, the dosage, and how frequency. It is not mandatory because physiotherapy used to not give any medication to the patients. He must to know if the patient is undergone for the surgery, how about the recovery of the wound. So wound healing process is very important. Second thing, after the surgery, patient has started to walk or not. And if the patient started to walk, and what kind of the aid he or she has used, which means the mobility aids like a walker or the walking stick or four-wheelie walker frame. So what it is. And then second thing, he must to know about the drainage, wound drainage is there or not. And also he must to know what kind of the physiotherapy exercise program has been given to the patient. So these all are the points important rather than regarding the medication part. Okay, so in the social background, what is the relevant history for the physiotherapist? Physiotherapist must to know more about what is the patient past medical history, especially fracture, CVA history, what about the patient weight bearing capacity, and also does the patient have any walking aids using or not, scoliosis is there or not. So regarding the physical related problem condition must be written in your social background rather than writing about hypertension, diabetes, because which is not relevant. It is not relevant to the physiotherapist because he is not going to give any medication to the patient for the hypertension and diabetes. But he must know if the patient had a CVA, if the patient had hemiplegia, stroke, if the patient had any previous history of fracture. So these are information which is related to the physiotherapist. Okay, and now coming to the point of the doctor and nurses. So doctor and nurses, we must write about all the medications, medical background and wound dressing and physiotherapy program, prognosis of the patient. And in the social background, you have to mention all the things. And for the doctor, it is not necessary to more about writing how many children the patient is having and each children what are the conditions. It is not necessary. Better you can write patient has the family history of, that is one word is more than enough, not necessary to uncle had maternal and paternal uncle and grandfather. So that is not necessary. Instead of that, you can write family history of. And for the nurses, also the same, like patient where they have lived and with whom they are living, and then what they are retirement from where, and either the single or widow or widower. So these all things is very important for the nurses to know. But when you are writing to a known person, patient's GP, completely you can omit the social background, very detailedly explain about the present medical history paragraph of the patient. This is about the doctor and nurses. Coming to the point of the dietitian. So for the dietitian also is very important not to necessary to write more detail about the patient present medical history rather than the condition of the patient and prognosis of the patient. It's not necessary about the medication part. So what I can write, patient was admitted so and so date, and because of the so and so condition, patient has undergone so and so surgery, and patient received so and so medications, and then like analgesics, antibiotics, like this is enough, not necessary the name of the medications. And also patient, how about the patient's wound healings. If the patient is patient has undergone for any blood transfusion because of the low hemoglobin, it is very important to write it because it will be related to the dietitian to give a menu plan which includes like iron rich diets to enhance the hemoglobin level. And coming to the point of social background history, what can I write for the dietitian? It is very important to write for the dietitian is what is the patient habit, smoking and drinking or drug abuser, and second thing, what is the patient's likes and dislikes in dietary and diet, and then he must to know about the height and weight, BMI of the patient, and does the patient have any food allergies. So these all are the points are very much important for the dietitian to know more about it. And also the dietitian must to know what is the patient past medical history, hypertension, diabetes, cholesterol, because dietitian is the person who is going to make a menu plan for the patient based on the patient medical condition. Okay, these all are the things is very important. Only this much is more than enough. Coming to the point of when you are writing to a letter, when you are writing a letter to the psychologist, for the psychologist, better not to write the medical condition of the patient, and rather than that, better to concentrate on the mental issues, not a medical issues, mental issues. For example, patient got admitted and patient completed with the surgery. Post-operatively, patient showed some depressions and refusing of the medication, poor memory, less concentration, agitated, aggressiveness, restlessness. So these are the things mentally related. Some people, they used to suffer with the post-traumatic stress disorder or the post-surgical disorder because of the anesthesia and postpartum psychosis. For the antenatal means postnatal mothers. So these are other things. So that time for the psychologist, don't write patient received this medicine, patient got as hypertension, diabetes. Better not to write that all the history, because psychologist is the person going to treat the patient mental illness, not a physical illness. So better try to avoid the physical things, like in the present medical history, patient was admitted because of so complaints and undergone so and so condition. During hospital stay, patient was noticed to have restlessness and poor memory, and patient was agitated, patient was denying to take the medications, patient was not cooperative, and patient refused to do the physiotherapy. So these and all things can be written in your letter is in the present medical history paragraph. When you are coming to the social background paragraph, write about the alcohol and drug abuse, smoking, childhood traumatic disorders, and the patient might have any depression, have they taken any medications for the previous mental illness, and family history of any depression, bipolar disorder, manic disorder. So these are other things only is very important for the psychologist to know about the patient, not a medical relevant, only mental related issues we have to write it in the letter. Okay, so these are the letters we have to, these are the way we have to write the body paragraph based on the recipient of the letter. So that has to be relevant. It's not necessary that which part has to be written first. For example, social background, or we can go for the present medical history paragraph. So there is no problem in that. But when you are writing the points which has to be relevant to the recipient of the letter, which means your letter is good to get B score. Okay, I hope this video will helpful for the students who is preparing for their upcoming exam, and also who plans to prepare their OET, and whomever wants to know more about OET, you can contact us at any time, and our number has given in our description. We have 40 days, 50 days, 60 days, 10 days, 20 days crash course, and we have a beginners class. All the classes are taken only in online, so you can contact us and then you can join for the class. Okay, so until then, bye bye.